Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
We have the case back from the laboratory at this time. At this appointment, we want to establish our aesthetics on the restorations, verify the margins, and also establish your anterior guidance. At this point, we would like to be able to get rid of the incisal pen, adjust the incisal guidance so that in the refinement of the posterior wax-up, as you can see here, the posterior teeth are still in wax because we want to now refine our anterior guidance, make sure it's the way we want it so that the teeth will write against each other and provide the guidance before we refine the posterior wax-up. We want to make sure that the anterior guidance is designed to clear the posterior teeth out in the working and the balancing. Remembering that generally the incisal guidance from our incisal guide table is straight and the lingual surfaces of the anterior teeth will be curved. So it's important to get the anterior guidance established on the lingual surfaces of the anterior teeth at this time. We have established the centric stops in gold on the lingual surfaces of the maxillary anterior teeth for our contact, and then we have our porcelain for our aesthetics. So we want to go in here now and adjust the anterior guidance to what we want in the mouth. So we will now go to the mouth and try these restorations in and adjust the margins, the aesthetics, and the anterior guidance. For this purpose, we probably only have to remove the anterior temporaries. Would you hold those, please? Been some time since these temporaries were removed. However, you can see that we've got pretty good tissue response under the temporaries. Got to make sure that the restoration fits the tooth the same way as it fits the die. So we want to go in here, check our margins and the contacts. Mirror, please. So as we try the restoration on, we check to see that it is seated by feel of the margins. Now, as we try in the next restoration, we'd have to check to see if the contact is tight. A piece of dental floss, please. We want the dental floss to slip through there snugly. That one appears to be fairly good. Now that contact appears to be a little snug. It pushes the other crown off. Would you give a piece of carbon paper, please? Now you can use a piece of carbon paper. Would you slip it between the crown there and put this to place? It'll give us some idea of where that contact is tight. And we can see where we'd like to remove this. And then using a safe side disc, we can go ahead and adjust the contact. Until we get the right feel, or the dental floss. It's still a little snug. Going to take a little bit off the lateral this time. Those are in place. The contacts feel just about right. They should just barely pull on the dental floss as we run it between the teeth. Now this one is quite tight. Sometimes there's a key to the way the teeth should be, or the restoration should be placed in the mouth. And we can see this one will go to place if we place this one first. Would you put the carbon paper between the two? Okay. Okay, we would go ahead with the rest of the restorations, doing the same thing, adjusting the contacts, and we'll go ahead and do the rest of those off camera. Dental floss. Have some carbon paper, please. Now that we've got all the restorations in, the contacts adjusted, we can go ahead now and check our occlusion. First thing we'd want to establish is good centric contacts, so we would check to make sure that we've got, no, leave those in, please. Make sure we've got good contact between the teeth. Close, open, close on the back teeth. Okay, we've got good contact on that one. Open, please. Close. Light there. Close. Open. Close. Open. Close. Open. Close. So we're a little high on the, tight on the canines and a little bit light on each of the centrals. So we can check to see where we're contacting. Close, please. Tap, tap. Open. Close. Open. Now the one contact that we have is on the distal of the canine. We want to remove that. You can see the contact that we have on this canine. Lighten the contacts to pick up a little more contact on the anterior teeth. Now we want positive contact on the canines and just barely a light contact on the centrals and laterals. Let's have a small stone. We can see the tissue relationship here. This tissue was in real good shape for having temporaries on that long, and this we attribute to temporaries that are properly designed and also a patient with good oral hygiene. Close, please. Tap, tap. Close. Just hold it. Now we just have a very light contact on the centrals and laterals. Open, please. Close. Open. Close. Open. Close. Open. Close. Open. Now I want you to slide from side to side slowly. Back. Now what we want here is a nice, even, smooth movement from side to side. So we want to contour, recontour, close, rub from side to side. Open, please, close, side to side. We've got the, open, please, the steepness of our incisal guidance established from the articulator and our study cast. We now want to adjust the concavity, the lingual concavity, on the restoration. As we see here, of where the guidance is coming, we're coming across the gold here and up into the porcelain. We have our centric stop, or our supporting stop here, and we want a nice, gentle concavity as we come out to the cusp tip. This gives us our slow guidance, or our lingual concavity for our guidance. So we will adjust that guidance so that we have a nice, smooth movement. And this is the thing you want to check in the mouth, is to see if the patient can move smoothly on these guidance areas. Should be no irregularity as it comes from porcelain to gold. Okay, close, please. Tap, tap. Now we still want to maintain contact. Open, please. Close. Open, close. Open, close. Open, close. Open, close. Open, close on the back. close, open, open please, close, open, close. Rub from side to side again, please. Now you can put your finger against the labial surface of the canine and tell her that's a nice smooth movement. If you feel any bumping at all in that area, then you need to reduce it some more. So we go to the opposite side, close, tap, tap, rub from side to side, open. Now if you'll notice closely, close, how this canine will be pushed to the side as he goes laterally. Rub side to side. That isn't a nice smooth movement. He's coming over some irregular area to cause a jolt against that tooth. Open, please. It isn't the amount of guidance that you have, it's the design of the guidance that is important in the as we see here, we've got a pretty steep guidance coming out of the mouth, coming out of centric here. And there's a little bit of a ledge that he jumps over to where he's pushing that whole tooth to the side as he comes across there. So we want to even that out, make a nice smooth guide area for the movement. Now this isn't a lot of grinding. These are very subtle adjustments that we need to have in there. So we want to establish this guidance at this time, because if we change it later on, this means that we've got to change all of the movements, contacts on the posterior teeth. So it's important to establish the proper guidance at this time. Now close, please. Tap, tap. Now rub to the side. Back. Again, it's a little steep. He's putting a lot of force against that side. Carbon paper, please. Close. Tap, tap. Rub to the side again. Now the guidance there is too steep because it's forcing the canine to move labially. Open, please. The one on the opposite side, close. Rub to this side. The other side, please. Which side is it easier to move to?
To the right.
To the right, because it's not quite as steep a concavity. Okay, let's reduce that a little bit more. So concavity, just as he moves out of centric, that is causing the most of the problem. This gives you overjet on the anterior teeth. You should have enough overjet so that the lingual surfaces of the anterior teeth do not contact. Okay, close. Tap, tap again. Rub to this side, please. Now, there's much less movement of that cuspid as he moves laterally. Open, please. We also look at the contacts that we'd have on our lower canines and see how broad and how far down the contact would be. We'd like to keep the contact up on the incisal edge, so we could narrow the incisal edge of the mandibular canine. Close, please. Rub to the side. But that's a much smoother movement now. Now, come out on your front teeth. Protrusive, what we try to do, back, forward. Try to establish an even contact here. We should shorten this lateral, because as the canine comes forward, we're riding pretty heavy on that. Close again, protrusive, back, what we'd want to do is to have as many of the anterior teeth in contact as we could. We wouldn't take off of the mandibular tooth at this time, but we would take off the lingual surface of the upper or the incisal edge of the maxillary tooth, because we only want to change that protrusive guidance. So we want to shorten this lateral incisor so that we can bring the central incisors into play. We don't want to shorten our mandibular canine. Again, make these concavities nice and smooth. There was quite a ledge as the patient came from the porcelain, or the gold to the porcelain. Close, please. Come out on your front teeth. Now we're picking up more of the rest of the anterior teeth. We'd go ahead and make the final subtle adjustments in our functional analysis. Close again. In our lateral excursions, we'd like the canines to contact only. Rub to this side, please. Nice, smooth movement. As they moved into the working and balancing movement, move the other side, please. Now out on your front teeth. And then have as many teeth in contact as we could in the protrusive movement. Now the gingival areas of these restorations are, I think, fairly good. The concavities, there's not too much bulk in this area. The teeth have the masculine characteristics. You see that the lateral is more prominent in the male. The incisal edges are more of a rugged-looking appearance, square corners. There's not much difference between the lateral incisor and the incisor length. The canines are longer and harsher. These are all male traits. You see more of the mesial surface of the lateral incisor on the male than you do the female. And these give the masculine characteristics. Now, would you wet your teeth? The length, just close, please. Leave those out. Close. The length of the maxillary teeth, again, this is dictated by function. Slide forward, please. You can't shorten those too much more, or you're going to pick up some protrusive interferences on the posterior teeth. For phonetics, the lip line, bring the lips together, please. The lip contour is not bad. Open, please. Just part your lips. No, just part your lips a little bit. This is what you would generally see. Open just a little bit more. And, of course, a big smile would show what the teeth would look like if the patient were to smile. But these are the things you would look for. Very seldom do you see a patient with their teeth like that. So I think these are pretty well ready to now put back on the articulator. And with our final guidance established in here, you'd want to polish the lingual surfaces of the anterior teeth, and we'd go ahead and do the refinement of our posterior wax-up, send it back to the lab for the casting and the placement of the porcelain on the posterior restoration.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.